As a hospitalist, I am usually meeting my patients for the first time when they are sick, scared, and need inpatient care. I don't have the benefit of years of interactions that are necessary to forge long-term, trusting relationships between doctor and patient. Not knowing much about a patient's personality can make it more challenging for me to communicate with them. And if I can't connect with my patient, they are much less likely to follow my treatment recommendations. That is why I was so interested in Frame Health.
Our management team has used personality profiles for years to learn how to better communicate with each other, our staff, and the doctors. But we didn't have the mechanisms or processes to apply this concept to improve communication with our patients. Then along came Frame Health. Frame Health allows us to tailor our communication style based on how each patient learns, understands, and accepts recommendations.
The framing approach makes it easier for me, makes the patient happier, and ultimately can lead to better outcomes. We are excited to introduce Frame Health.
The two leading forms of death, heart disease and cancer, have enormous research support and great institutions behind them. But the third has almost none. That killer is patient non-compliance, and it happens when a patient doesn't follow the treatment plan given to them by their doctor. It also costs health systems hundreds of billions of dollars a year. Now I know, patient non-compliance does not evoke the same emotional response as the other two. But does it really matter if it takes your life or it takes the life of someone you love? Now, why does this happen? According to the Institute of Medicine, nearly 50% of adults have trouble understanding and acting on health information. It's a 50% communication failure, and that's unacceptable. Frame Health has set out to change that. I'm Bruce Ettinger, CEO, founder of Frame Health. At Frame Health, we analyze the personalities of non-compliant patients and tell the care team exactly what they need to do to treat that patient. Patient starts by taking the Frame Health Personality Survey. We then take those responses and convert them into clinical insights. A compliance score shows how likely a patient is to follow their care plan. But then we provide very specific instructions on how to treat each patient. Let's take a look at Scott and Lewis. Now, while their compliance score is similar, they have entirely different personalities and they have to be treated differently. Let's look at Scott. So Scott is the type of person who does not like to miss a due date or a timeline. For him, the most important thing is to understand what he has to do and when he has to do it. Let's look at his Frame Health recommendation. Define treatment plan tasks clearly for best results. Now, when the doctor talks to Scott, he says, Scott, I'm putting you on this medication. You have to take it twice a day without fail. I'm going to see you in 3 weeks, and I think this problem is going to be behind you. That is how Scott has to hear that information passed to him for him to understand it and act on it. Now let's look at Lewis. Lewis has an entirely different kind of personality. Things have to make sense to him. They have to be logical. For Lewis, the most important thing is to explain why he has to do something in his treatment plan. When the doctor talks to Lewis, he says, Lewis, I'm putting you on this medication, and over the next 3 weeks, this is going to enhance your kidney function somewhere between 20 to 40%, and I'm going to send you home with some very detailed literature that's going to show exactly how this engages with all the major organ systems of your body. Now that is what Lewis needs to hear for him to understand his treatment plan. Now what you've just seen was generated by the world's largest personality database with millions of profiles and over 30 years of data. This research was started at Johns Hopkins, and it is now owned by Frame Health exclusively. We charge when we profile patients and create communication recommendations. This has value for many healthcare stakeholders. For health systems, they make money when their clinicians communicate better with patients and their patients are more compliant with their treatment plans. For insurers who carry at-risk populations, they make money because we drive costs down. For pharma and retail pharmacy, they make money when patients take their pills. And Frame Health has a partnership program that allows other leading digital health providers to embed Frame Health right into their software solution, which gives them a non-compliance capability in their own software. This is a way to get the benefits of Frame Health to millions more patients. And soon we'll be able to say to all digital health providers, has your app been framed? Now, it has been a pleasure working with our colleagues at Cedars-Sinai, working on integrating this new communication technology into their process of care. And I'm very pleased to announce 2 commercial deployments with Cedars-Sinai. The first is to get high-risk patients to enroll in a special program that increases their medication adherence. The second is right on the hospital floor, working with doctors and other clinicians, helping them better communicate treatment plans to patients to help those patients avoid readmission. Now, in addition, over the past few months, other great health systems, including Kaiser Permanente and UCLA, have committed to deploying Frame Health. We have a very strong team. I have overseen the sale of more than $40 million of behavioral health products, and our stellar tech team has architected solutions for companies ranging from American Airlines to American Express, and includes the founding software architect through IPO of Athena Health and founding CTO of Castlight. Our sales are led by the former Senior Vice President of Hospital Corporation of America. At Frame Health, we believe that when patients are treated like the individuals that they are, it will not only save billions of dollars and save millions of lives, it will also further enhance the humanity of this great practice of medicine. At Frame Health, we know patients because we know people, and we'd like to get to know you. So please stop by at reception, take a Frame Health personality survey, and I will know exactly how to talk to you. Thank you.